When we started about 10 years ago in our own practice, there were a couple things that I thought we were going to do differently. One is that we wanted to offer an experience that was different than what other people were going to get in this area. I liked something more cosmopolitan, or sort of a Miami or New York type of experience, where people were going to get a type of service, a level of service that they really didn't expect. And so by developing the relationships with the patients and making them feel like part of our family over the years, things have been growing steadily until the point at which, frankly, we can't do much more. Well, it's important that your plastic surgeon's board certified, because just because it's called plastic surgery doesn't mean that you have to be a plastic surgeon to do it. Lots of people believe they can do plastic surgery, and there's nothing stopping an eye doctor from doing plastic surgery, and in some parts of the country there are even family practice doctors doing it. It's very important that your doctor is a board certified plastic surgeon. In fact, I tell patients, if you don't choose me, at least make sure you pick a board certified plastic surgeon. So in plastic surgery, a lot of people have an idea what they want to have done, or maybe just know what parts of their body or face they want to fix. But from the very first phone call, we want them to feel like they're safe, they're well taken care of, and they're valued. So from the first person who answers the phone first to our office manager, Michelle, having basically a concierge experience ready for them, we want them to be able to come in the office already knowing some people, being greeted by those people, and meeting everyone, not just myself, during the consult, and then in the pre-op visit, the second visit, getting ready for surgery. They have an opportunity to ask all the questions, and the patients not only have my cell phone, they have my office manager's cell phone to text or call with any questions that they have, weekends and the evenings, and so patients know that we're always there for them. A lot of patients, when they come to our office, are not only scared, but they're embarrassed. They're embarrassed to actually show me what their problems are, especially if it's their body, particularly the tummy or the breasts. Even though I explain to them that this is what I do every day, taking a patient like that through the feeling of being embarrassed to being comfortable with us and our staff and comfortable with the plan, and then delivering a great outcome, doesn't just make them look better. We get the satisfaction of making them feel better and be more confident, not just at the beach in a bikini or bathing suit, but really making them have a more confident personality. For me, the fun part isn't so much the medical part, it's the creative part, getting an idea of what I want to do, accomplishing that, and a lot of times it's kind of like being Santa Claus every day. So I was able, once I got busy enough, to specialize my practice to doing only what I love doing. And so now I'm in the unique position, especially for the area, to specialize in only cosmetic plastic surgery. All the patients are coming from different situations. I had a patient today from about 4 hours away. I have patients from other states, and patients that have to fly here for their surgery. So through my office manager, we're able to coordinate pretty much whatever a patient wants. I mean, anywhere from where they're going to stay to rides to and from surgery. So as we've grown, we've learned to accommodate all kinds of challenges. So we're in Hilton Head Surgery Suites right now. This is our operating room area, and this is really where it all happens. As long as I've been in plastic surgery, I wanted a surgical suite. I wanted an experience where the patient could have the ultimate in privacy, but have everything available that would have in a surgery center or a hospital. But I wanted to have the specialized staff, the same staff that's used to doing my procedures, be with me for all the cases. So it's not just who I'm assigned to that day. So this way, I'd be able to have my own hand-selected staff, the setup in the operating room that I want, the instruments I want, everything the way that I want it. And I wanted the ability to be able to keep a patient overnight. We do have a lot of patients from out of town. Maybe they don't have someone who they want to ask to take care of them overnight. Maybe we have a surgery that goes longer than 6 hours. And so as a board certified plastic surgeon, I have to make sure they stay here so that we have a nurse and an assistant with them, 2-on-1, all through the night. And I wanted to be able to give that kind of an experience in a place that also kept them away from some of the germs and the sicker patients that are in the hospital. And here, they not only get that experience, but they also have the same staff, the same ladies that they met from the very beginning, the people they talked to on the phone in the beginning, are here seeing them and helping them and checking them in, and even stopping over from the office to the surgery suite just to check on them and say hi. Well, when we started, we wanted to give people the kind of family comfortable experience that they weren't going to find somewhere else. And now, 10 years later, when patients come in and they're so thankful and they love the experience and they feel like part of the family, well, that's really the highlight of our day. And when I say our day, it's the whole team. The experience isn't with me. They spend a lot of time with the whole team. And the greatest compliment that we can have is when someone sends a friend or a family member to us for surgery. Now, 10 years into it, that's most of our patients are being referred by sisters, neighbors, people they work with. You could give someone a great plastic surgery experience, but if you don't deliver the product in the end, well, I guess that doesn't count. My staff will probably tell you that I'm more than a little bit particular. It's just as I tell them, because if it was your mom, you'd want it done right. And so that's what we do, is we treat everyone as family. And I always think, what would I do if it was my wife? So in the end, we try to deliver the best plastic surgery result there is. I never set out to be the fastest. I never set out to be the least expensive. I only wanted to do one thing, to be the best plastic surgeon in the area. That's why I specialize in only one thing, cosmetic plastic surgery. That's where all my effort goes. We opened Hilton Head Surgical Suites, which is part of Weniger Plastic Surgery. We opened the surgical facility as a Quad ASF accredited facility. Now, there are multiple accreditation boards for office-based surgical facilities, but this is the highest. It means we get inspected regularly. It means that we have to have certain equipment and protocols to make it the safest experience that could be delivered, possibly. We do a lot of extra work that we might not otherwise have to do to hold ourselves to the highest standard. In the OR here, we do a lot of face surgery. In fact, we probably spend the most time in the operating room operating on facial aesthetics. We do upper and lower eyelids. We do a lot of forehead lifts or brow lifts. We do facelifts, and there are multiple kinds of facelifts that we do. There are even many facelifts that we can do. A lot of our operations involve fat grafting to the face, and many of the procedures have laser resurfacing associated with them to smooth the skin, in addition to just lifting or plumping. And for other patients, maybe they're not trying to fix signs of aging, but even younger patients may have concerns about their nose. So we do a lot of rhinoplasties or nose jobs, and we do other facial implants. We do chin implants, and sometimes we do cheek implants and implants in other areas of the face. The most common operation that we do at Weniger Plastic Surgery is breast augmentation. Patients want breast implants not just if they're in their 20s, but sometimes older, 40s. We even have some patients in their 70s who just want to develop some of the fullness that they used to have when they were younger. A lot of times we're not just doing augments, though, we're doing breast lifts. Patients might be happy with the volume that they have. They just want it back up here where it used to be. And so we can take the breast tissue that they have and actually just lift the nipple position and tighten up the skin. But in a lot of cases, especially after having children, women need to have the volume replaced with an implant and have a lift so that they not only get the size they used to have or bigger, but they get the perkiness that they used to have as well. One of the most important things about breast surgery is listening to the patient. Because patients might say, what kind of breast augmentation do you do? What kind of implant to use? There are so many options that I couldn't even list them now. And that's why really the most important part of this doesn't happen in the operating room. It happens when I'm meeting the patient and spending the time that it requires to really understand what a patient wants so that we can fulfill their wishes. The most common body contouring procedure in plastic surgery is liposuction. And we do a lot of liposuction here. But oftentimes we're combining it with other operations that you might not think of. We do tons of tummy tucks or abdominoplasties. And most of the time we're combining that with liposuction too. It could be in the tummy or in other areas like the love handles. But when we're doing liposuction these days, we're often asking the patient what they want to do with that fat. Because usually when you do liposuction, patients think you're just going to throw it out. But these days, a lot of patients want to use that fat to augment their own breasts with their own tissue, or more commonly, put it in their buttocks. In fact, the Brazilian butt lift is the fastest growing part of our practice. Taking fat from other areas where you don't want it, inner thighs, tummy, bra rolls, love handles, flanks, hips, and putting it in the butt to give the narrowest waist and a rounder, fuller buttocks. Another operation that we do, especially for patients who have lost tons of weight, is a lower body lift. Sometimes people call this an around the world or a circumferential abdominoplasty, meaning a tummy tuck that does the front and the back. When there's loose skin all the way around, we can literally remove that extra section, pull the pants up, and make it as tight as possible, and tighten the muscles in the tummy and make that as flat as possible. Other times, patients have lax skin in their thighs or their arms. Sometimes that's from weight loss, but sometimes it's just from age. And we can remove extra fat through liposuction and tighten the skin in that area to make the contour as tight as it can be on those arms, getting rid of laxity that maybe flops when you move your arms or any excess skin that you see hanging from maybe a short sleeve shirt. The other thing that we do in the operating room, or even sometimes in the office, that many people don't even know is a possibility, is vaginal rejuvenation. Many women, especially after having kids, but maybe even at a younger age, have an appearance of the outer genitalia that they're really unhappy with. In fact, some people can have labia that rub together and make it literally difficult for women to run or exercise. It's very easy, surprisingly easy, to fix that in a very small operation. Sometimes patients want that by itself, but a lot of times they might be having a breast augmentation or a tummy tuck and asked if we can do that at the same time. It's amazing how happy women are with the result of an operation they didn't even know existed. Really, everything that we do down at our medical spa, Lux, is an outpatient procedure. And when I mean outpatient, you come in and 15 minutes later you get in the car and go to lunch. There's really nothing that we do down there that has any significant downtime, and that's why patients love being able to come in regularly and take care of their concerns, volume in their face or their skincare, really with no downtime at all. Well, a medical spa is different from the normal touchy-feely spa that you might go to for a massage or a facial. Really, everything that we do at the medical spa involves a scientific approach to rejuvenating the skin or adding volume that's lost through facial aging. So we use fillers to add volume, or Botox or products like that to reduce wrinkles. And sometimes we're treating the skin for color or brown spots, like red spots and brown spots on the skin with lasers. And importantly, we're using medical grade skincare and getting patients on a program of prescription skincare that's not only going to reverse a lot of that sun damage, fine wrinkles, brown spots, but actually prevent the aging process, prevent skin cancers, preventing wrinkles and preventing those spots from developing in the first place. So really what we're doing at Lux is a non-surgical age management program. Well, as a doctor, no matter what your specialty, your job is to help people. And a lot of people think as plastic surgeons we're helping people look better, and that is true. But what we're really doing is helping people feel better. We help people feel better about themselves, not just the way they look. We help them have more confidence for their jobs, for dating, and really just so they're happier when they see themselves in the mirror and they see what they feel. People these days, especially living longer, feel healthy, they have a lot of energy, they're out playing tennis, they feel young, and they want to look young like they feel. And this is why we do what we do. This is why I love my job. It's helping people feel better, helping people look better, seeing the smile on the face, getting a hug, sometimes even getting tears when people are so happy that we made them feel a way about themselves that they didn't even remember feeling in the past.